Welcome to Adapting Class. Thank you for deciding to watch this video. Risk reduction is a very big area of your exams because it's a safety question, it's safety exams. So everything is safety. So I'm taking key content area that you need to know, like for blood transfusion, all of them, and then we have created questions regarding to that. You have to know these little concept. Is the little concept when you build it up, you have a great concept to take the exams. So let's get to it and deal with some safety issues. Before that, adapting class, you hearing me? We have a couple of channel membership. Go the NG and go that have restricted videos. If you want to join at the adapting class YouTube channel. Click any video that you see, just click join, and then you get access to unrestricted restricted videos. Or you can join us on free review on Wednesdays and Saturdays. Wednesdays is on YouTube, Saturdays on Zoom, the Zoom ID, and the YouTube, and the times on the screen. Or if you need a course, on-demand course, crash course, this is my website where I do all this high yield content that will prepare you, make you more confident for your NCLEX. First question, risk reduction, safety question. Which intervention reduces the risk of infection? Is a selected apply. And nurse is caring for a client with what? Neutropenia. That means the patient is at risk for infection. What actions you can take to reduce the risk of infection? Encourage frequent hand washing by the client and staff. Hand washing is number one. That is appropriate. Provide fresh fruits and flowers to improve morale. This can lead to infection. To the patient who is neutropenic, they should avoid fresh fruits and flowers. Place the client in a private room. Excellent. Will prevent infection. Place the client in a semi-private room with another neutropenic client. They will cross-contaminate each other. Two neutropenic cannot be together in the same room. They always need pure private room. So that is a wrong answer. Perform frequent oral care with non-alcoholic based solution. They usually, because they immunocompromised, they have oral trash. So you cannot use mouth, syringe or mouth, any mouthwash that contain alcohol. So you use a non-alcohol based solution to wipe their mouth to prevent candidiasis formation. Therefore, what is the right answer? As you can see, is our content, and washing is good. Fresh vegetables is wrong. Placing in a private room is good. Place the client in semi-private meeting with another patient is wrong. Perform frequent oral care with non-alcoholic basis right. And so read the question. Say, which intervention reduces the risk? So you want the right thing. Patient is bad. Place the client in a private room is good. Patient cannot be in a room with another person. So even though it's in neutropenic, they cannot be together. Perform frequent oral care with no alcoholic based solution to prevent the trash. So select apply. This is designed to teach you select apply. You cannot pick any more than what you can bite. Pick those you can bite. If you can bite four, pick them. If you can bite five, pick it. But you have to be confident. So you don't overguess. If you have to guess, run away from selected apply. You better choose what you're more confident and don't guess the rest. That's all. I'm satisfied with three answers. I'll proceed with the answer and I'll go. That's what you do if you're taking the test. Which action should the nurse take to reduce fall risks? The same thing. Risk reduction. A client with a history of fall is prescribed sedative. You're going to give him something to make him sleepy. He's more likely to fall. What do you want to do? Raise all four side raise on the bed. That is the wrong thing. Entrapment. You causing what? The patient to be in an entrapment position. You're restricting them. So that is wrong. Keep the bed in the lowest position. Yeah, it prevents the patient from falling. Place the call light within reach. Number one cause of fall is patient trying to reach for an object that they want. So if the call light is within them, they press on it, the room light, and they walk. Ensure the client has non-slip footwear. Yes, so that you don't fall. Conduct a fall risk assessment so that you should know. Select and apply. Pick those you're confident. What do you think? Number two, three, four, and 5 are your right answer. So this is the way you should answer the questions. If you see them, that's the way I want you to approach them based on content. Same thing. Highest risk of developing a pressure ulcer. Who is likely to develop pressure ulcer? Highest risk is a selected apply. That means there's more than one answer there. 30-year-old, a fractured femur, and has well-balanced diet. There's a buzzword there. The buzzword is well-balanced. So far as you have well-balanced, that means good nutrition, your wound will heal well. A 65-year-old with chronic incontinence, perineum is wet all the time, and poor nutrition, albumin is low, this patient is not going to heal. Just from chronic incontinence, the perineum will have a lot of fluid, it will be leaking, prevent wound healing, and his nutrition status suck. So therefore, 2 is the right thing. A 50-year-old with diabetes and hypertension, just having diabetes and hypertension does not mean you're more likely to have problem with pressure ulcer, right? A 75-year-old is immobilized. Yeah, you're not moving and your nutrition is not great. These two combination is a bad combination. So first, you're not immobile, you're not moving, and you have nutrition problem. That's patient is at higher risk. A 75-year-old who ambulates with a walker and has osteoarthritis. He walk with a walker, he ambulates as far as he can, but he has osteoarthritis. So this patient does not need, is not at risk of pressure injury. The 4 is at risk of what? Pressure injury because of immobilization and more nutrition. 3 is not. Chronic incontinence and poor nutrition is. So number 2 is a problem. So we have 2 and 4 are the right answer. So you got to look at it based on the contents. Not everyone is right. So 2 and 4. A post-op client report calf pain and swelling. What action should the nurse take? Calf is hurting and is swelling. It's a post-op, most likely has DVT. What do you want to do? Notify the healthcare provider. It's an emergency, right? You don't massage the area to relieve the pain. It's going to cause the embolization of the clot. Assess for redness and warmth in the calf. Yeah, this is the diagnosis of that. Apply a warm compression to the area who causes inflammation. Keep the client at bed rest. At first, we keep them at bed rest after DVT with the fear of dislodging. Look, now, standard of care, you don't need to. You don't need to do that. If you don't let them walk, there will be propagation of the clot. So let them walk and walk around. So what are the right answer? The doctor about this problem, about DVT, we're not going to massage the area. We're going to check for redness. We're not going to apply compression for inflammation. And we're not going to keep you at bed rest. So we're not keeping you at bed rest. We're not going to use warm compression that causes inflammation. We're going to assess for redness and warm of the calf. We're not going to massage. And then we let the doctor know. This is a test-taking strategy. Only 2 answers are right. What should the nurse do? Select or apply. And then suspect a blood transfusion reaction. What do you think? Incompatibility. What do you do? Stop the infusion quickly. Yes. Notify the healthcare provider that this is what is happening. He's going to tell you to keep the IV lines open. He will tell you to stop all transfusion. But what do? You don't need blood type and cross match at this time. When you start getting blood, it's too late. So before you get blood, that's when you get a blood transfusion, that's where you get a blood type and cross match. But now you don't need it. Discard all IV tubing that contain blood. You should leave it as an evidence. Therefore, what is the right answer based on what I've explained? What is the wrong answer? You should not discard it. Okay, you don't cross-check blood type and cross match. No, not this time around. Okay, we don't need to recheck it again. We already know it, right? Maintain IV access with normal sealing. This is good. Notify the healthcare provider. We have the transfusion reaction and stop all transfusion immediately. These are the concepts you have to know. And that is the way I'm using the concept to answer the question. And the client is unconscious with cold and clammy skin. Which nurse action is appropriate? Select or apply. The buzzword is unconscious. When you have diabetic patient who is unconscious, it's hypoglycemia most of the time. Based on the symptoms, this is hypoglycemia, but you have to know how to figure out how to treat them. Check the client blood glucose. Based on the symptoms, to suspect hypoglycemia is good. Give them glucagon or 50% dextrose because he's unconscious. He cannot use his mouth, right? Reassess the client vital signs, right? So that you know what is going on. Notify the air care provider so that you know what is going on. Position the client on their side to prevent aspiration. Yeah, if he's unconscious, it's better to put them in that position and administer 12 grams of oral glucose. Patient is unconscious. You should not put anything in their mouth. So 6 is wrong. So what are we looking for in this situation? Well, you check the client blood glucose, treat the problem, reassess his vitals, let the doctor know, and then position the client on the side to prevent aspiration. This is a quick risk reduction information. If you want more, check out adapting class. And thank you very much. Good luck. Best of luck.